Hello, and thank you for tuning in to learn more about the Benton-Franklin Community Health Improvement Plan, otherwise known as the CHIP. My name is Kelly Harnish, the CHIP coordinator at the Benton-Franklin Health District. This presentation is the first of a three-part series that focuses on the 2020 CHIP. Before we get into the details, I'd like to make sure that the concept of the Community Health Improvement Plan is well defined. The Public Health Accreditation Board defines a Community Health Improvement Plan as a long-term, systematic effort to address public health problems on the basis of the results of community health assessments and community health improvement processes. This plan is used by health and other governmental, education, and human service agencies in collaboration with community partners in order to set priorities and coordinate targeted resources. The 2020 Community Health Improvement Plan was informed by the 2019 Community Health Needs Assessment, otherwise known as the CHNA. Benton-Franklin Health District partnered with local agencies including Cadleck, Trios, Lourdes, Prosser Memorial Health, Benton-Franklin Community Health Alliance, and Providence St. Joseph Health to form a steering committee. The steering committee worked diligently to ensure a wide variety of sectors of populations were represented through stakeholder interviews and community listening sessions, including representation from a wide array of sectors serving the public and intentionally seeking to elevate the voices of diverse and marginalized population groups. In all, the steering committee completed 11 listening sessions, 16 stakeholder interviews, received responses from over 100 stakeholder surveys, and analyzed 120 community health status indicators. Once the data was collected and organized into preliminary groupings, the steering committee scheduled a community partner compression planning session, inviting agencies and partners from the respective distribution lists. Partners who participated in listening sessions and stakeholder interviews were also invited. Over 50 representatives from public health, hospital and health systems, behavioral health, community service organizations, first responders, and business and education sectors reviewed the data, identified important issues, and came to an agreement on the critical top 3 priority needs for change. The 3 priority areas determined by that process included social determinants of health, access and cost of all health care, and behavioral health challenges. As I mentioned, this is the first in a 3-part series. This presentation will focus on the priority area of behavioral health challenges. While the Community Health Needs Assessment identified the problem, the CHIP identifies the solution. The solutions start with a wide view and narrow down to defined action steps. In this example, we see that the problem identified by this Community Health Needs Assessment was the need to address social determinants of health, such as housing, food, safety, and so forth. A set of goals was then established that could address that problem, one of which was that people have access to stable and supportive housing. From there, an objective that will help fulfill the goal is to increase the understanding of the actual gaps and needs related to housing and homelessness in the community. Now there's an action to take. The same pattern follows throughout the CHIP under each priority area. Under the priority area of behavioral health challenges, there are 2 goals. First is that Benton and Franklin counties are more resilient through community support and connection. The second goal is that people receive needed behavioral health services in a timely and effective manner. Under the first goal, there are 2 objectives. We're going to take a look at how these objectives have been met through action by Benton-Franklin Health District and partners in the community. The first objective is to increase community awareness and support prevention efforts related to behavioral health challenges. The second objective is to reduce stigma around behavioral health challenges and increase community awareness amongst those who serve the community through education and outreach to agency staff members. So walking through the CHIP altogether, priority need 3, behavioral health challenges. The first goal, that Benton and Franklin counties are more resilient through community support and connection. And the first objective under that goal is to increase community awareness and support prevention efforts related to behavioral health challenges. Some evidence of this activity is that Benton and Franklin counties have approved a sales tax of 1 penny per every $10 to go toward mental and behavioral health care and access. This starts in April 2022 in Franklin County and June 2022 in Benton County. And this will relieve dependence on grant funds and from cities. This sustainable amount of funding is estimated to secure an annual funding of $1.4 million for behavioral health and substance use treatment programs in our community. Another way Objective 1.1 has been met was through a partnership between Benton-Franklin Health District, Key Connection, and the local school districts. This team created and distributed nearly 100 positive messaging signs to each school district to support community morale during the summer of 2020, the first summer of the COVID-19 pandemic. Benton-Franklin Health District and Key Connection partnered to run Mental Health Mondays radio ads, reaching about 230,000 listeners, according to reports from Stevens Media. Benton-Franklin Health District also provided trauma-informed training series for school staff with GRIT. There were 4 sessions in April and May of 2020 with 108 attendees. The Greater Columbia Accountable Communities of Health have reached thousands of students in this region through the Practice the Pause campaign. Information about this campaign can be found on their website and will be running again spring of 2022. Other community partners such as Catholic Charities, Lutheran Social, and ESD 123 provide various community education sessions on behavioral health services and provide suicide prevention. The local affiliate of the National Alliance on Mental Illnesses, or NAMI, provides various community support groups and classes for families and individuals affected by mental health conditions. They provide online presentations focused on increasing mental health awareness and promote mental health resources and services, and hold twice per month support groups for individuals and families living with mental illness. Some of the ways that CADLEC has addressed the need to improve community awareness and support prevention efforts related to behavioral health challenges is that they provided question, persuade, and refer suicide prevention education sessions to the general community and multiple local organizations. They also partnered with Miss Washington and Miss Outstanding Teen Tri-Cities on mental health-focused community education. And they maintain a community resource desk, which assists community members with resource connection, including for behavioral health needs. Another activity around suicide prevention was performed by CADLEC and the Benton-Franklin Community Health Alliance, who supported Ranch and Home Retailer in providing gun safes for free or at low cost to owners of handguns as a way of means restriction. Behavioral health resource cards are being provided to home builders associations in the area to put into homeownership packets to provide new homebuyers with resources for behavioral health services. At the Benton-Franklin Community Health Alliance, Kirk Williamson testified twice before the legislature in support of Senator Brown's bill to stand up a tip line. He also served as a member of the Washington Youth Safety and Wellbeing Task Force, and it made its recommendation to the legislature in July of 2021. Kirk was also appointed the new Tip Line Advisory Committee of the Attorney General's Office to advise and support the tip line's development. The second goal under behavioral health challenges is that people receive needed behavioral health services in a timely and effective manner. There are 4 objectives under this goal. The first is to compile and analyze community-level data, leveraging partnerships from different sectors to better identify and support programs addressing behavioral health challenges. The second objective is to improve treatment access for substance use issues for those residing in Benton and Franklin counties. The third objective to expand mental health services to better meet the needs of the community, based in part on the results from the first objective. And the objective number 4 is to respond to community behavioral health needs related to the COVID-19 pandemic and response. The first objective, compiling and analyzing community-level data, leveraging partnerships from different sectors to better identify and support programs addressing behavioral health challenges, is being met through a partnership between Benton-Franklin Health District, Eastern Washington University, CADLEC Regional Medical Center, United Way of Benton and Franklin Counties, and the Greater Columbia Accountable Communities of Health, along with Benton-Franklin Community Health Alliance, to design and implement a full needs assessment taking place in spring of 2022. The full report will be deliverable on June 30th, 2022. In summary, the 2020 Community Health Improvement Plan was born from the 2019 Community Health Needs Assessment. The CHIP focuses on 3 priority areas of social determinants of health, access and cost of all health care, and behavioral health challenges. This is one part of a 3-part series to update the community on how the CHIP is being implemented. As the Community Health Needs Assessment and Community Health Improvement Plan are on a 3-year cycle, the next iteration of the Community Health Needs Assessment has begun. The steering committee meets weekly to plan the data collection activities for the CHNA. The 2022 CHNA will be complete by fall of 2022. The 2023 CHIP, Community Health Improvement Plan, will be an updated version of the 2020 CHIP with additional aims that reflect the findings of the 2022 Needs Assessment. Benton-Franklin Health District, Benton-Franklin Community Health Alliance, and partner organizations consistently check in on CHIP goals, objectives, and actions so that as a community, we realize the vision for better health, equity, and well-being. In case you're wondering about any of the acronyms used in the presentation, here is a quick glance. This list can also be found in the full CHIP document on the Benton-Franklin Health District website. Thank you so much for tuning in. Please feel free to reach out with any questions or comments regarding the Community Health Needs Assessment or Community Health Improvement Plan. Have a great day.